You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, new treatment options for people that are suffering with low back pain and neck pain. But today's topic, it's not just about getting out of pain, but getting back to function, your daily activities with new techniques. With us, we have the leading physiatrist, medical doctor in the desert, Dr. Mark Bouffard. Dr. Bouffard, welcome to the program.
Thanks for having me back.
Now, we've had you on the program before.
Yes.
And for those that don't know exactly who you are, and you work with Dr. Roland Reinhardt.
Yes, I work with Dr. Reinhardt. Been with him 2 years now.
All right.
After finishing my fellowship in pain management. So.
Now, you're board certified as a physiatrist, physical medicine, and rehabilitation.
Yes.
Exactly what does that mean, by the way?
The other term for it is a physiatrist, as you've been saying.
Okay.
That is somebody who specializes in restoring somebody to their full function as much as possible. You know, we've worked in residency. I've worked with stroke patients, amputees, people with chronic pain syndromes, traumatic brain injuries. Okay. So we want to get them back from their illness to functioning as much as they can independently.
Okay. Now, I've had Dr. Reinhardt on the program, and he says you treat pain like an emergency at your center.
Yes.
Do you feel that same way?
Yes, because studies have shown that people that become inactive actually have harder times becoming more active down the road. So you need to treat the pain as aggressively as you can at the early stages.
Okay, now your background,
yes.
Your training, did it make you more sensitive to the needs of the patient?
Yes, and also with the family's needs too.
Okay,
because I would hear the family say, well, they're not their old self that they remember.
Okay.
So I wanted to help them and their family.
Now you radiology, that was your first. I mean, you were a radiologist at the beginning?
No, my father's a radiologist. So I grew up around x-rays. So I've been around x-rays. I've seen images of them, since I was small. So he'd always bring them home when he was studying for his boards, bring them home. We actually had a view box at home.
Okay.
So we would have films there. So I'd, look at it, and, I remember being small, and like one of the first images he ever showed me was this image when you turn the spine sideways. It's what we call the Scotty dog. It looks like a Scotty dog. And what's really interesting now is that a lot of the injection techniques that I do based on the Scotty dog is where I direct the needle. So something that he taught me back when I was 5 years old is what I'm still using today.
So so you didn't want to be a radiologist. I think we talked, you didn't want to work in a darker room.
Yeah, no patient contact.
Okay.
I wanted to be with patients, want to help them out.
But you like the radiology part. You were saying that because you can detect things, you can find the problem.
Yeah, I can see what it is, and that's why I went into physiatry too. I did that because not only did I want to help people get better, but I wanted to help diagnose what their problem was. So if they have, say, low back pain, because first of all, Randy, pain is the #1 reason patients will go see a doctor. Okay. So somebody comes in with low back pain. Well, there's lots of structures in the low back that can be causing pain. Is it spinal stenosis? Is it the facet joints? Are they arthritic? Is it a pinched nerve that's causing pain going down the leg? I want to figure that out.
So finding, you call it the pain generator.
Right.
Oftentimes things are misdiagnosed or missed.
They're missed because, as we get older, we have more problems. Okay. And now, somebody comes to us with low back pain. Even if we get an MRI, it'll point to several things. But which one is it that's causing them pain? You need to figure that out so you can treat them effectively.
Okay.
Otherwise, you're just going to be kind of giving them like a shotgun approach. You're going to treat everything at once, but you may not be treating the right thing. Okay.
The Wellness Hour now airs nationwide, even in Canada.
Yes.
And I think people in the desert, I always tell people in the desert that they're spoiled when it comes to pain management.
Right.
Because, and since Dr. Reinhardt was the first interview I ever did with a medical doctor on pain management, that I think the perception is that everybody has a pain management center that's comprehensive like yours, where everything is under one roof. You have a physiatrist there, you have a pain management specialist there. But I mean, is that true that they're not all the same?
No, they're not all the same. Some of them, some of the centers do a lot of their management by doing just medication management.
Yeah.
Others are a lot of injections. Okay, so
that's right. I mean, you may go to the one person that just handles medication, pain center, one person that does just injections, and one person that does the implantable devices.
Right.
And you do it all there.
Yes.
I'm trying not to be on your side, by the way, but I think it's important to know.
No, we have it all there. You know, I work closely with, like I said, I try to get people back to function. And what I mean function is I, first of all, ask the patients, what is their goal about coming to pain management? What do they want to accomplish? Some of them it's just to go for a walk with their grandkids when they come to visit.
Do they tell you that?
Yes.
On the consults?
Well, that's one thing you have to ask them, because they'll, you know, when they fill out their paperwork, they'll say, I'm here for pain. I'm in pain. Well, what kind of pain, and what is that doing to limit you? You know, what's it limiting you to do that you want to be able to do? You know, because, you know, everybody has a different goal. Is there not
enough of that going on in medicine today? With the focus, you have a bias, obviously you're a physiatrist, getting people back to function. Not enough of that going on with that emphasis, that focus?
As being a physiatrist, I don't think it is. I mean, we see a lot of patients that are in pain, but other doctors are trying to help them get out of pain. But the other things too is, like you mentioned, were pain management.